Hey guys, welcome back to my channel, and if you're new here, my name is Kristina. In my videos, I talk about a plant-based diet, nursing school, and my cancer journey. If you like these type of videos, please like this video and subscribe down below. In today's video, I'm going to be talking to you about why I decided to start nursing school and if you should too. Let's get into it. The reason why I decided to start nursing school stems back from all the way from my undergrad. So originally my plan was to go to medical school. So I graduated with my bachelor's in biology and was on that track to apply to medical school. I knew that medical school was very competitive, so I really wanted to get my master's so that I could have a competitive edge and get accepted to more schools. So I ended up doing my bachelor's in biology as well as my master's in biology. Now, during that time where I was doing my master's of biology, I came across many of my professors. They actually had their PhD and MD. So I actually interviewed a few of them and asked them questions about medical school and if they thought that it would be still a good route. I've always wanted to become a doctor since I think in my elementary school yearbook it says pediatrician since I was younger. So ever since that age, I really wanted to become a pediatrician. So nursing wasn't my first passion, but as my life progressed, it led me to nursing. So like I said, in my grad program, I would speak to my professors. I asked maybe 4 of them what their thoughts were on me going to medical school instead of the PA school route or nursing school route. So each one of them really strayed me away from going to medical school. They were if you don't have much family, and if you don't have children, or if you're not married, then it would be a good route to go to or go through rather. But if you have children, or if you're in a family, then it's a lot harder because you have so many years of residency, and it is really time consuming. Not that nursing school isn't, but it's just a shorter commitment with nursing school than becoming a doctor. Because once you become a doctor, you still have to do the on-call hours. You still have to have I think some crazy shifts depending on what hospital you're in. Nurses still do have crazy shifts, but it's a lot different. Being on call especially is just super draining. At least that's what my professors had told me. So I was really bummed out that I originally wanted to become a doctor of osteopathic medicine, specifically a pediatrician working in the oncology unit. But then after hearing all the stories, I was no, I'm not going to do it. I just made the decision that I just wasn't going to do it, and I really wanted to focus on my husband and just figure out another profession for me that I could have kind of the best of both worlds. So I actually found out a few months later that I was pregnant with my daughter, and it was such a blessing because I just had decided that I wasn't going to go to medical school, and then that happened. So it was kind of crazy how things, my path just unfolded for me. So I was grateful for that. And I actually, like I've said before, my cancer journey. So I actually was diagnosed with, it's called mucoepidermoid carcinoma, and that is a form of salivary gland cancer. So it was actually in my parotid gland, which is in this region over here. And I had a tumor within my parotid gland that we don't know how long it was there for, but I definitely was able to feel it. And I was my own advocate of saying hey, something's not right, we need to get it checked out. And a lot of doctors that I went to were kind of I don't think there's anything really wrong. It's probably just a swollen salivary gland. Suck on some lemon drop candy and just don't worry about it. I even went to the hospital, and I remember a doctor there was just she's oh, there's nothing that I could really do for you. Here's an antibiotic, I guess you could have this. And she basically threw this horse pill at me and was just here, take this, and if things don't get better, then go see this ENT, like ears, nose, and throat doctor. So I was just like, okay, kind of thrown off. So after I was able to see an ENT because like the antibiotic didn't do anything, I specifically went to Memorial Sloan Kettering, and that hospital is like supposed to be like the best for like if I had any like cancer, anybody that's like their doctor is kind of unclear whether or not they do have cancer, but it's like kind of most likely. So I originally saw like doctors outside of Memorial Sloan Kettering, and then I needed to like find out if I had cancer. So I went there and they did more like tests and biopsies and all these like different things, and they finally caught it. So they saw that I had stage 4 mucoepidermoid carcinoma. Try saying that 5 times fast. But it was really difficult because I found out literally, so I was pregnant with my daughter. I found out I was pregnant. I graduated from my grad program that May. Then I had my daughter that July, and then I was diagnosed with cancer that October of that year. So literally all those things happened in 1 year, and then I started my treatment. I had surgery the following January. So like a few months later, I asked my doctor if I could just have like time for myself to go like on a vacation with my husband and daughter, just so that I had to have like the holidays, at least like Christmas and the New Year, to like just have time by ourselves. Like the treatment and the surgery itself is very demanding. So like they have to like cut my face, like all this over here is just like my incision line, and it was really, really difficult to go through that. But I'm super grateful I did, because one of the nurses at Memorial Sloan Kettering, she was absolutely phenomenal, and she's the reason why I decided to become a nurse. So when I originally went there, they didn't even know if I had cancer yet. This was just like me going in for like consultation and diagnosis. And for those of you who don't know parotid gland cancer, I had no idea about it before I was diagnosed. But you do, anytime you have like a tumor in this region, you automatically have to get it removed, because it's just like a hot spot for cancer to form. So even if it's benign, the tumors will grow progressively, and it will start impinging on the nerves like around your face. So like we have a nerve right here that is like a spider nerve, so it'll connect to your eye, to your nose, to your mouth, and I think a little bit further down, but it's like goes like this, and it's like starts in like almost like a ball and spreads out. So that's kind of like where the tumor was. It was like here, right directly on top of it, and kind of like spidering on top. And that's kind of a characteristic of cancer itself, which is pretty crazy. It like encaps it, which is really, really, I thought it was fascinating, because before even finding out I had cancer, I was super fascinated about cancer. And in my grad program, I had the opportunity to like learn about the biology and mechanics of cancer. So tracking back a little bit, when I had like a biopsy done by a different doctor, I already had a hunch that I had cancer, because they did a different biopsy there, and my doctor never called me back, and I thought that was weird. So I actually called the hospital where I had the biopsy done, and as a patient, like, you have your rights to your medical documents. So I had them send it to me directly, and I read my own report, and I just remember sitting there like crying, because I knew that all the different possible types of cancers that they thought were all cancer at the end of the day. Like, it said it was a growth, but it also said like 10 different types of cancer that it could be based off the cells that they saw. So that was definitely a difficult moment for me, but I was really happy that like I had all the support and guidance that I needed. So backtracking forward, like I said, at Memorial Sloan Kettering, I met that nurse, and her name was Anne, and she was absolutely phenomenal in her care and her bedside manner. And not up until that point, like, I never thought about nursing. I just was like, I was too high and mighty about becoming a doctor, and I was just like, I am gonna be a doctor and I don't need to be a nurse. Like, I kind of knocked the profession, and I'll be honest, like I really like didn't appreciate nurses, and I think that it like going through nursing school right now makes me have such an appreciation for just how hard of workers they are. And I think that many people don't really know how hard they work. Like, I know that there's like half the population that is probably like, yes, nurses, they're awesome, we need them. And then other people are kind of like have the same mentality as me, where we're just like, oh, like, you know, that's just like basic sort of thing. But it's not at all. It's like far from that. Nurses need to know a lot of information, and like the material that I learned in my biology program versus like nursing school is completely different. Biology is like studying cellular, more like A&P, anatomy and physiology, whereas nursing school is like head to toe assessment, learning about the body, learning more like how to be like a doctor in a way, because at the end of the day, you're like a doctor's right hand woman or man, and you need to be able to know what you're talking about to help the patient as a team. So it makes sense that a nurse really should be considered a physician assistant, because they are the ones that like are treating the patients directly, are helping them get better. And they do take orders, but they also need to be aware of anything that may go wrong with the patient during that time. It is your responsibility that if you see a patient that has like a respiratory rate of 10 breaths per minute after you gave them a narcotic, that hey, maybe I should stop this narcotic, or hey, maybe I should call a doctor, or I should put them on some oxygen. So like, it is up to us as nurses to be an advocate for these patients, just like Anne was for me. She would just listen to me, she wrote down everything, she was attentive, and I really appreciated that, because when you're in that moment and you find out that you have cancer, it is not fun. Your whole world spirals. Like, finding out that I had stage 4 cancer at 28 years old was not something that I wanted to hear after having a baby. I was like, am I going to be able to be a mom for my daughter, for her to grow up and for me to see her grow up? I mean, this cancer is considered 1 in 200,000 people have it. So I'm like, this is very rare, this is very like unheard of, and I had to like take a step back and really reflect on what I wanted in life and change my outlook. So point being, if there are different things that are occurring in your life that are preventing you from going to nursing school, such as like your family doesn't support it, or you have financial issues where it may be hard to go, or in my situation, you have health issues that are preventing you from going or delaying you from going, do not let those things get in the way. If you want something bad enough, you're going to do whatever it takes to get there. So it may not have been easy for me to be undergoing my treatments and applying to nursing school and trying to take all the requirements that were needed, but I made sure that it happened. I did whatever in my power that I could. I reached out to any support systems around me, like my friends and family, to help guide me on what I should do. And at the end of the day, the person who supported me the most were like my friends, my family, and my husband especially. Like, having that support is needed. And if you don't have that support, be your own support, or find a friend who could help you get through it. Because at the end of the day, you want to do something that you love. And being a nurse is an amazing profession where you get to have that experience of helping someone else. There's nothing more gratifying, in my opinion, than helping someone else who actually needs the help and wants the help. When you have a sick patient in the hospital and you see them for the first time and you're actually caring for them, it is the most rewarding feeling ever. So for me, that was my why. Especially for me, being that I had cancer, I really want to work in a pediatric oncology unit, and I want to show my daughter that I made that possible because I made sacrifices and I did things that weren't comfortable and were out of my element so that I can get there. I didn't think that I would be trying to figure out what I wanted to do in life later on. But I'm doing it, and I feel like it doesn't matter how old you are, it doesn't matter if you have a single dollar in your pocket right now. There's a will, there's a way. There's scholarships, there's different things, there's loans that you can take out that are from the government so that you could have a reduced rate on like your interest. That's obviously not ideal, but hey, if it means that you're going to become a nurse at the end of the day, do it and pay off that debt right away. So at the end of the day, nursing school is not easy. Is it worth it? 100% yes. I believe that if you know your why right now, before you start nursing school, or even if you are in nursing school, find your why, because that will push you forward every single day. Anytime that I have a rough moment or a rough day or a rough week, I remember, what is my why? Why am I doing all of this? And it keeps pushing me forward. It becomes into 1 week becomes into a month, and before you know it, your program is over. So just keep pushing forward. There are going to be challenges in it. There are going to be classes that are going to like drive you insane, or you feel like dumb because you don't understand the material. But hey, you're not supposed to understand the material yet. This is why you're learning. This is why you're in school. Focus, pay attention, and do things to help you academically. Watch YouTube videos, like, this one is informational, but watch other YouTube videos where they're talking about like the actual skills in place. It really helps if you're a visual learner. Make sure to stay organized, and I have other videos like this to help you get through nursing school. So use this as a resource. I want to help you succeed as well. So I hope you like this video, and I hope you guys find your why. Like this video and subscribe down below. I look forward to seeing you next time. Bye guys.